So if you look on the side, you have your external paddles on the device. So if and when you need to use external paddles on your patients, you can actually just take your therapy cable here, you can plug it into, and the paddles roll off with your thumb. So you just click down and they roll right off. Your therapy cable is going to plug right here into your external paddles and clip in. You can remove your other paddles so you have both paddles in your hands. So if you, or when you need to defibrillate your patient, you're going to need to either apply adhesive electrodes, like 3M adhesive electrodes, or use specific defibrillator gel. If you use ultrasound gel with these paddles, you will burn somebody. So it is not recommended. So these paddles have an adult shoe on them. If you press down on this black tab here and then pull up, you also have a pediatric shoe underneath these as well. So when you are ready, if you needed to, you can actually go ahead and charge from the defibrillator here or from the paddles. And it takes about 25 pounds of pressure and pressing these buttons simultaneously in order to deliver the shock. So if at any time a Zoll defib is charged and you do not want to shock the patient, let's say either on the paddles or on the front of the device, you can hit energy select up or down and it will dump the shock. You can also choose your energies here, up or down, and you can dissipate the shock as well on your paddles. If you're using internal paddles, your internal paddles, when you plug them in, are going to power up at 10 joules and max out at 50 joules when you're using internal paddles. So all of your Zolls also have the ability to monitor non-invasive blood pressure, SpO2, and end-tidal CO2. So if you look at the front, if you look at the front of your device, you've got a little arm button right here. So when you turn your defib on, either in monitor or in defib mode, this button right here is always going to be on. If you press this one time, it allows you to take one blood pressure. If you press and hold it for 5 seconds, it will take a stat blood pressure every 5 minutes until you turn the defib back off again. SpO2 monitoring, fairly straightforward. You're going to have a cable on the back of this that's going to have an SpO2 sensor. You can either put this on your patient's finger, or if you have disposable leads, you can disconnect here and plug in a disposable SpO2 sensor into your Zoll. And then the last option, which is the most important one of all, I believe, is end-tidal CO2. So end-tidal CO2 is on the back of your defib. You're going to have this 87-foot cable that rolls out the back of this. There should be a small plastic piece called a capnostat. This is your inline piece, so when you have an intubated patient, this is going to go into your ET tube. The sensor is going to clip on either way, forward or backwards. There's no correct way to do this. So when you click the sensor on and you turn your defib on, it's going to take approximately 30 seconds for it to warm up on the front of your device. But when you breathe into it, you'll have your millimeters of mercury right here, your respiratory rate, and then you have your waveform on the bottom. The only time that waveform goes away is when you go to charge the defib. The energy levels will cover it up, but as soon as you either dissipate the shock or shock your patient, within 3 or 4 seconds, that waveform is going to automatically pop back up again. Okay? And really, the last piece on the Zoll is really about all the different cables that we have on the back of it. So if you look on the back of this device, there are a number of different cables that are integrated in this. So the first cable has a red ring on the bottom of it here and a screw into the top of it. This is kind of nature's way of saying don't touch. This is what's going to defibrillate your patient. So unless you have tools on you in the middle of a code, you're never going to unplug the wrong cable. The next one over is SpO2 monitoring. The next one over is where the confusion comes in sometimes. So the way we're going to lead these Zolls is we're going to have this cable that has a black ring on the bottom plugged into the back, and then the one that has a screw and the red ring on the bottom plugged into the back. So these are the integrated 3 leads that you have on your adult pad. So when you go to put on your therapy cable on a patient, this thick therapy cable actually has 2 cables built in, the 3-lead cable and the shock cable. But let's say you change your pad placement to the anterior lateral, or let's say you need to pace a child. If you have to do that, you're going to need to unplug this cable, and you'll need to plug in your 3-lead on the back of the device, and then your 3-lead will then go directly onto your patient just like any other 3-lead you use in the hospital. The next cable over is yellow ring. It says CO2. This is where your end-tidal CO2 will be plugged in. The next one over says NIBP. This is where your non-invasive blood pressure hose will be plugged in. On the top of the defib, we have your battery and your printer. So your battery, if you press this button here, these LEDs will illuminate and show you what the charge capacity is. So these new batteries will have up to a 4-hour runtime for monitoring somebody. But the recommendation from Zoll is to leave them plugged in at all times. Remember, when it does the test, it actually tests the charge capacity on the battery. And then the printer is right here on top as well. So the printer actually has a picture inside that will show you how to properly load the paper. So if you forget how to load the paper, just look inside there and it actually shows you what way to correctly drop the paper in. When you get a new ream of paper from Zoll, it'll be a little thicker than this, but it's going to look just like this. So all you need to do when you're going to load paper is drop this paper in, pull this sheet out, and close the door, and the paper's loaded. Fairly straightforward. So the last thing about maintenance on your Zolls is how to do their daily tests. So it's my understanding that you have to do a test on your Zolls every shift. So in order to do a test on your Zolls, you're going to want to make sure that you're plugged into AC power. You know you're plugged into AC power because these lights are on. So your front light, first light here, right now on mine is orange. It just means the battery is charging. Once it's fully charged, it will turn green. If you see that your battery light is toggling different colors, it just means your battery's not seated. You just need to go up there and give it a little tap and it should seat just fine. The next light over there is your AC power light. So actually both of these lights will be on when you're plugged into AC power. If for some odd reason you walk by and you see that these lights are actually off, you're going to want to check your wall connection, or if you look on the back of your device, there's actually going to be a rat tail that the AC power cord will plug into. So check this. This is a common place that they come disconnected on the defib. So when you're ready, what you're going to want to do is take a set of either adult or pediatric electrodes, depending upon if it's a pediatric or adult cart. Plug in set of electrodes. Make sure that your defib is plugged into AC power, so you have your lights on. You never unplug it from AC power when you're doing the test on these. So there are two tests that you need to perform on the device. So the first test is a 30 joule shock test. So in order to do the 30 joule shock test while the defib is turned off, you're going to turn it on. You're going to turn your energy down to 30 joules. You're then going to charge the defib, and you're actually going to press the down arrow. That's going to dump the shock. We then want you to bump it back up to 30 joules, charge, then when it's ready, hit the shock button. It should say 30 joule test okay, defib pad short. It's shorting the energy into the pad sets that you have it plugged into. So the defibrillator will store 1,000 daily cell tests. So the first test that's in there is the first one that goes out. So it basically has a couple of years with the data plug stored internally. So I look now on the front of my device, I now should have a green check mark showing you that I passed my daily self-test. So that's the first test. The second test that we ask you to do is a pacer test. The pacer test does not have any indication on pass-fail in front of this. This is nothing more than a nursing competency test to make sure you understand what the pacer knobs do. So with the pacer test, you have it plugged into electrodes. You're going to turn the center knob down to the green area on the bottom of the device. And if you look on the right-hand side, the default from Zoll is 70 ppms. You're going to want to increase your rate, or ppms, up to 150 on the nose. You then hit the recorder button, and then press and hold this 4-to-1 button. And what you're watching is actually not the monitor, but you're watching the printer paper, and you're looking for a small gap on the paper to go to a wide gap. And once you see that, you can actually hit stop. So you can see here we have a small gap, and it goes to a wide gap on these pacer spikes. We then want you to turn up your output knob here, and on the screen, we want you to turn it to at least 16. So we just tell customers just to let it rip. Turn it up as fast as you can. Don't worry about backing it off if you go past it. You're then going to unplug it from a set of pads. So when you unplug it, it should start screaming at you. And the recommendation is to then plug the pads back in, hit clear pace alarm, which is flashing down here on the left-hand side, and turn the device off. That concludes the insert. So on the Zoll One Step Complete pediatric CPR pads, the pads now have the ability, as we showed you earlier, to coach your nurses on the quality of chest compressions they're giving a patient. If you look on the front of the pads, it will show you the age and weight range. So we'll say from 0 to 8 years of age and up to 55 pounds. What we say is, even if the pads envelop the entire patient's chest cavity, just don't let them touch on the sides if it's that small of a child. When you plug in pediatric pads and turn the defib on, it's actually going to know it's plugged into pediatric pads. It will change the energy to 50 joules on the first shock, automatically escalate to 70 joules on the second shock, and then 85 joules on the third shock. So it's very specific to the pad sets it has plugged in. If you want to change the energy from 1 to 200, you can still do that, just like on the adults. And the other neat thing this does is, if your nurses hit the analyze button and use this as an AED, it changes the algorithm to determine if the patient's in a shock rhythm based on a pediatric specific algorithm instead of an adult algorithm, which we use if you have adult pads plugged into the device.